everyone. Today I'd like to talk to you about the differences between Japanese and Chinese or TCM acupuncture. So, I'd like to start with the Japanese style because of course that's where my training was. I was trained in Japan and worked there for over a decade. And after coming to the US and then working with a lot of international acupuncturists, I realized that there's a huge difference in acupuncture. So let's start with the needles. So acupuncture needles in Japan are extremely refined. This is something that you might see at a Japanese acupuncturist office. If you can see those, those are 3 different sizes, 3 different types. This is a brand called Sadine, which is my favorite for not reusable, for needles that are disposable. The reason why I really love these needles as opposed to a Chinese brand of needle that other TCM practitioners are using in the United States and around the world is because they have a high quality control system set up at their plant. They are made in Japan, and I'm going to talk about the few differences in their quality control. So if you were to in another video, I'm going to actually set up using a microscope, looking at the difference between a TCM or a Chinese practitioner needle. I know there's some needles that are being made in Germany as well. Looking at the tips of German-made needles, Chinese-made needles, and the Japanese-made Sadine, especially Sadine needles, but also some of the, I'm just going to show you guys, some of the needles that aren't reusable. So these are silver needles. Some of these needles, you can barely see that probably. So thin. But yeah, some of these needles, and just looking at the differences in the tips with a microscope, so that's in a different video, stay tuned for that. But the tips are made completely different. So often Chinese needles and German needles, what's going to happen is the tip, instead of being nice and sharp at the tip, it's going to have a little bit of waver. And so that's going to make the needle, the penetration into the skin is going to be more painful. It's going to feel like a hot burning feeling oftentimes. And also it's going to be harder to really stimulate and encourage the wei qi, or that surface level qi, and then the different layers going down into the body. And that's more of a technical thing, understanding that there's qi that's moving on the surface of the body, away from the body, and all the way down to the bone level. They all have qi and energy moving, and then the acupuncture needle is going to influence that energy at all of those different levels. Tips of the needles really are important to be able to accurately and precisely stimulate all of those different levels. Another place that the quality control is different is where the shaft of the needle enters into the handle of the needle. And so the Sadine especially, and also some of the handmade needles that are coming out of Japan, have great quality control of this area. And so you're not going to get breakage of the shaft and the handle. Unfortunately, with a lot of the Chinese needles, you do get some breakage there. And then also the shaft of the needle is more precisely made on the Japanese needles, whereas the Chinese ones tend to have some barbs. So that's just differences in the tools specifically. Other things that Japanese acupuncture, that TCM acupuncture, and an actual Chinese acupuncture in China, one of the differences is that in the Japanese style, they're going to use what's called a teishin. I call this an acutherapy tool. Acutherapy is a tool that works with the qi, or the ki, as I call it, the ki that moves on the surface of the skin and above the skin. And these tools were developed originally for something that was more like surgery. So if you look at a Manaka-style teishin tool, for those acupuncturists that are watching, you probably know what it is. It's like a little hammer that you are able to use with this. Now they just use it to stimulate the surface. Before, they would use it to actually insert this sucker into the body. And you got to understand that when they were developing this technique, it was when surgery really didn't exist, especially in China. But they developed that in Japan. I have seen someone actually insert one of these thick needles into the abdomen, and both the practitioner and the patient were both like, yeah, that's not comfortable. So don't worry, I would never do that to any child or any patient ever. I only use these for the surface of the skin. And they're really, really great. They're not sharp. They are just enough stimulation for those of you who are really sensitive, or for children. I've used that to treat my newborn the day he was born for bruising. And I've used it on other newborns, and I've used it all the way up to a 93-year-old woman. It's just such a useful tool. There's a lot of different sizes and styles of these though. So in a previous video, I also covered differences in MOXIBUSTION. So if you're interested in the differences of MOXIBUSTION, definitely go and check out that other video. It's on my channel. So one of the other things that's really different that I find between Japanese acupuncture and TCM in particular, and also Chinese acupuncture, is that Japanese acupuncture is very palpation based. So we're going to base our diagnosis and our treatment of the patient in front of us where their body is at that moment right then, and that might change 30 seconds later. And so we train our hands to be able to accurately palpate and understand how the body is moving and changing, which is really great for, especially for pediatrics, because children's bodies just change so quickly. When you go into a TCM practitioner's office and a Chinese practitioner's office, unfortunately, they're just not trained to palpate as much. They're going to rely a lot more on your pulse and your tongue in order to diagnose, and that makes the treatment a lot more protocol based. That doesn't mean it's less or more effective. I mean, I'm a little stuck up, so I think that Japanese acupuncture is the best at everything, but acupuncture in general, everything is really great. It's just that TCM and Chinese acupuncture, because it was based on an herbal lineage, it's a long story, but it just made it a lot more protocol. So they're going to take your pulse, they're going to look at the tongue, and they're going to say, okay, you need this, this, and this point, and they're going to put them in and leave them there. They might stimulate them with an electric machine, and then they'll come back 20 minutes later. Japanese acupuncture does retain needles, is what we call it, to leave the needles in the body as well, but not all practitioners do for every point. In my lineage of acupuncture, Iyashinomichi, we do not retain the needles ever. That's just not what we do. So I'll place one needle and then I'll wait for the energy or the ki to arrive, and then I move on to the next point. I never retain a needle. So it's really great for children. Of course, with children, I'm not inserting needles, but it's great for pregnancy when you have to move a lot because you're uncomfortable. And I'm never leaving the room. So another huge difference between especially my lineage of acupuncture and other acupuncture styles is that my lineage of acupuncture does acupuncture treatment extremely quickly. So we're able to do a complete treatment in anywhere from 10 to 30 minutes, depending on what's going on with you at that moment. Where I would say that traditional acupuncture, TCM here in the States, is going to say, oh, we need at least 45 minutes just for the treatment. And that's because, again, they're retaining needles and they're leaving you there for 20 or 30 minutes. There's a historical reason as to why they do that, but I'm not going to get into that right now. So to summarize all of that up, there are a lot of reasons and a lot of things that are different between Japanese acupuncture, my lineage of acupuncture, Iyashinomichi, and TCM and Chinese acupuncture. That doesn't mean that any of them are better than or worse than the other. They're all trying to do the same thing, and that is to help the patient in front of them and make sure that that patient has the happiest and healthiest life that they possibly can. So the moral of the story is to go get acupuncture, because everyone should have it. All right, so if you guys liked this video, if you found any value in this video, please feel free to comment, like, and share it. Subscribe to the channel. There's going to be more videos coming out on various different topics of acupuncture for both patients and practitioners. So I hope to talk to you soon, and yeah, have a great day.